My name is Laura Gitlin, and today I will be talking about the role of meaningful activities in supporting people with dementia. First, I'll provide some background and the significance of using activity in daily care for people with dementia. Then I will review some of the specific roles of activity in supporting people with dementia, some of the principles that you can use in introducing activity as a therapeutic agent, and some concrete examples from some of the research that we've been conducting on the important role of activity in dementia care. To begin with, as you are aware, there are no disease-modifying drug treatments to date. As a consequence, medical bodies globally have endorsed 4 major treatment goals for people with dementia and their families. And these goals are to provide different approaches to enhance a person's ability to maintain quality of life throughout the trajectory of the disease, to help the person maintain function and engagement in activities, to support families who are primarily responsible for the everyday care of people with dementia throughout the disease trajectory, and to manage medically their comorbidities. Activity is a very promising therapeutic agent that addresses 3 out of these 4 treatment goals. A little bit about the background and research on activity. Most people with dementia spend most of their day doing nothing, whether they're living at home or in some kind of residential facility. In other words, they're sitting around and they're not being engaged in activity that has any meaning to them. There are a lot of very important serious consequences to lack of activity and lack of appropriate stimulation. Lack of stimulation can lead to isolation, increased dependence, a poor quality of life, and very importantly, an increase in behavioral and psychological symptoms such as aggression, agitation, depression, and apathy. There's a growing body of research that suggests that using activity as a therapeutic approach in the daily care of people with dementia can address many of these dire consequences. Activities have been shown to reduce the frequency and intensity of behavioral disturbances, to increase positive emotions, and to improve quality of life overall. This is a growing body of research and we need more evidence, but the promise is definitely there. The promise is such that governments worldwide have recognized the importance of activities, and some, including the United Kingdom, for example, have begun to mandate the use of activities as part of standard treatment for people with dementia. So what's the role of activity, and why is activity so important? Activity helps to maintain a person's sense of personhood and connectivity. It helps the person feel themselves. And this is an enduring need throughout the trajectory of the disease, whether a person is in the early stages of dementia or in the later stages of the disease. Activity can also provide continuity for a person from their past to present by helping them participate in activities or previous roles that they had. Activity provides an important meaning and purpose in daily life. It provides a goal that people can reach. And again, these are all enduring needs that people with dementia experience throughout the disease trajectory, but which we often neglect to attend to when we're caring for people with dementia. Also of importance is that activity may have a physiological benefit. For example, introducing exercise activities can help maintain the physical strength, balance, and cardiovascular fitness of a person with dementia. It can also help regulate diurnal patterns, which become very affected with the progression of the disease, and it has been shown to improve sleep. And again, keep in mind that the research in this area is expanding and growing, and it is promising. These are promising suggestions of what activity can do. Let's take a look at the clinical trajectory of Alzheimer's disease in particular and see the role of activity. At the normal and preclinical stages, there are population-based studies that have shown that participation in various forms of exercise and being engaged in meaningful and novel cognitive and social activities may prevent cognitive decline. Now, there aren't causal studies showing this relationship, but observational studies on large populations are very promising in this regard. Upon the onset of cognitive loss and memory loss and other kinds of changes that occur with dementia, social, physical, and cognitive activities that then are tailored or shaped to match the person's interests and their preserved abilities have been shown to reduce behavioral symptoms and also prevent these symptoms. Even activities that are introduced at the severe stage of dementia can be very important, such as sensory stimulation and touch and music, to help relax a person and help them feel connected to their social and physical environment. So here you see that across the trajectory of the disease process, there is a very important role for activity. So let's think about how we might use activity in our daily care for people with dementia. And on this slide are listed some very basic principles for using activity. And these principles have an evidence base. They have been shown in research to be some of the best ways of using activity. So for example, selecting activities that match or tap into a person's previous or current interests, what they used to do, in their work or their habits, is more successful than a one-size-fits-all approach. In other words, providing one type of activity to everybody. Also of importance is knowing how to modify the activity and basically downgrade or simplify the activity to match a person's abilities as they move along the disease course. Key here is simplifying, for example, the number of steps in an activity or providing verbal or gestural cues to help a person initiate, sequence, plan, and move through a particular activity. Another critical principle that's very difficult for people to understand is that when using activity for people with dementia, we must relax the rules and remember there is really no wrong or right way of conducting a particular activity as long as the person is safe. The goal for the use of activity is to engage the person with dementia in something that is meaningful to them. The goal is not to teach something new to the person with dementia or have them master a new way of performing a particular activity or to perform an activity correctly. So a person who may have been a professional or a well-versed card player with moderate stage dementia may not be able to follow all the rules, but may be able to feel content and be happy to engage with cards by sorting them in different piles, for example. At the moderate stage, activity as a therapeutic agent is very, very critical. And at this stage in particular, it's important to consider activities that are repetitive in nature. Again, we're not looking for teaching something new. It's the role of engagement that's very beneficial and supports quality of life. So repetitive activities like vacuuming or sorting cards or placing beads in a bin are all examples of repetitive type of activities that can be successful at this stage. Introducing activities that use gross motor motions, for example, washing windows or folding clothes, is another type of category of activities to consider. In introducing activities at the moderate stage, you want to draw on what we call procedural memory. Things that were learned a long time ago, like the movement of washing a window, for example. Again, the point is not to stress a person with new learning tasks. And then, of course, with the disease, we know that it affects people very differently, and that there are pockets of preserved capabilities that people have throughout the disease process. And through various kinds of assessments, we can tap into what those preserved capabilities are. So, for example, one preserved capability for many people with dementia is their social ability, their ability to be socially graceful and introduce themselves and have a everyday conversation. And so drawing on social capabilities, for example, is something that can be introduced in the kinds of activities that are considered. Another principle for using activities is to consider the time of day. For example, it's best to use more active activities during midday versus in the evening, in which quiet activities should be introduced in order to help the person get ready for a quiet nighttime and sleep time activity. Also, think about ways to integrate activity in a structured daily routine. The more a daily routine is structured for a person as they advance through the disease process, the easier their day is for them, and activities can be introduced at various points of the day as part of structuring their daily routines. Now, how do we take activities and match them to an individual's abilities? So there are four basic categories of approaches for modifying what we call the properties of activities. And this draws from the American Occupational Therapy Association approach to activity analysis. So if you're working with a person with dementia and you're thinking about what they can do and what they can't do, there are different ways that you could set up an activity. So the first is that you can modify the properties or the objects, the tools, the materials that are used in an activity. And as I've said before, the most important modification to the property or objects of activities is choosing an activity that is of intrinsic interest to a person with dementia. You also can adapt materials to enable use. So if a person has poor eyesight, for example, you can adapt a small puzzle and enlarge the puzzle in order for that person to see. Another property of an activity that can be modified are what we refer to as space demands. What does the physical environment look like when you introduce the activity? Think of where the person may be seated, and are they in a comfortable chair? Think about the lighting and the noise level, and make sure to create a calm and relaxing environment. And I'm going to show you shortly some some examples of how you can use these types of modifications. A third approach to modifying properties of activities concerns the social demands. So what does the person need from their social environment to successfully participate in an activity? For example, they may need certain prompts. Mom, come sit next to me. Let's look at this book of photos. Turn the page. Great job. Those are just some very basic examples of praise statements and specific prompts that can be used to make an activity successful for a person with dementia. And then most importantly, and as I have already discussed, relaxing the rules. There is no right or wrong way as long as a person is safe and content and engaged in the activity. The final way that you can think about modifying the properties of activities has to do with its sequencing and timing. So you can modify the sequence of steps to perform an activity. For example, if you want to play a game of dominoes, maybe one way of setting up the activity is to have the dominoes be able to be placed anywhere on the board and not just on open tiles. Also, providing verbal, gestural, or written cues to help a person follow the steps in an activity is another effective modification. You could introduce more physically active activities in late morning or early afternoon and more quiet activities in evening. And this kind of modification all reflects ways of modifying the sequence and timing of activities. So these are four basic, broad ways that you can think about modifying any type of activity in order to make the activity a therapeutically effective approach for a person with dementia at any stage of the disease. So here are some examples. Here's Mrs. B, and you might not be able to see in the background, but she has a whole set of beads, and she was a bead collector. And she is at the moderate stage of dementia. And even at this stage, she is able to take a box of beads, as you see in the upper right-hand corner, and she's able to sort beads and put different colors of beads in each of the containers, and then string beads. So this activity taps into Mrs. B's interests. It provides her a two to three step activity. And we can downgrade this activity as Mrs. B progresses through the disease. So for example, instead of offering all these multiple colors of beads, we can perhaps only offer red and blue beads. And then in the future, with progression of the disease, we may have Mrs. B only work with one color beads, and maybe she would take the beads in and out of the container, or if she's still able to string them on a necklace, that would be her activity. So as you see, with this one type of activity of beading, we can adjust it in multiple ways as Mrs. B's cognitive status and functional status changes over time. But we're always tapping into her bead collection and long-term interest in beading. I wonder if you can guess what this woman was in her working life. As you see, she's very engaged in looking at a puzzle of letters. She was a librarian. So again, picking up her interests with working with letters and words was an important element in determining the right activity for Mrs. S. Now, you can see that this puzzle is enlarged. Okay, we have adapted the property of this particular activity board so that it can be a successful experience for Mrs. S. But even here, all the different letters are a little bit too confusing for her. And so another type of modification was needed, and we had to simplify this activity even more by placing a cloth over all the other rows of letters so that she could focus her efforts on the one row and place letters successfully in this row. So this is an example of progressive simplification of activities, as well as the importance of tapping into interests, because Mrs. S loves words, loves written words, and likes to engage with letters. Here's Mr. M. He's a carpenter, and we developed an activity board with all different kinds of faucets and different kinds of objects that he could screw on and off. Mr. B is at the moderate severe stage of the disease, and yet even here he's able to engage in this activity board for over an hour. And it was distracting for him in a very positive way. So for example, the son who was caring for his father could use this activity board in order to prevent and monitor behaviors that were very stressful to everybody in the family. So the son reported, "My dad was a carpenter all his life, but he has started to make inappropriate sexual comments to my wife when she enters the room. This strategy diverts Dad's attention by engaging him in an activity that is repetitive in nature and that has meaning, such as this activity board." Physical activity for people who are able to participate in physical movement remains very important, again, throughout the disease. And there's all different kinds of physical activities that can be introduced. You could introduce activities, exercise that is done through when people are sitting on a chair, for example, or if the weather is bad and a walk is impossible, you can introduce different kinds of physical activities in the home, such as the ones that you see here. Now, I'd like you to meet Mr. K. Mr. K is 83 years of age. He was admitted to a geropsychiatric unit in an acute care hospital at Johns Hopkins, and he was admitted by his wife, who cares for him at home, for his extreme agitation, his anxiety, and also his general apathy or withdrawal. He has a mini mental status examination score of 16, which means that he is at the moderate stage of dementia. He was previously employed as a chemist. He has a very high level of sociability, but his language is very challenging, and he's very challenged by speaking and can only speak in brief words, which has been a great source of agitation to him. His wife reports that he basically sits at home and does nothing, and she believes that this also increases his agitation. Now look what Mr. K can do. This is an outline of his cognitive functioning. He can handle objects, he can engage in repetitive actions, he has very good eye-hand coordination. He also understands the meaning of concrete activities. He can distinguish size, shape, and color, he can line objects in a row, and he can use short phrases. So taking this knowledge of who Mr. K is and also conducting an activity interest inventory, we discovered that Mr. K really likes to be engaged in action. What I'd like to show you now is a very brief video clip of Mr. K playing table hockey in the hospital, and take a look at his affect and his level of engagement.
All right, Mr. Kennedy.
Yeah. Right.
You and Charlene, we got the game set up.
Okay, here you go.
You want to start?
You want to start?
Maybe you start,
Well,
Charlene.
one stroke, so you can get a feel of it. Okay, you can get a feel of it. Oh! Oh, yes! Look at that. Oh, wow.
That's okay.
So that's
One.
one.
Well, that's the first one.
Okay. Wait a minute. Was that a test? Oh!
It's going to be more than it's going to be
Okay. All right. Okay.
Come on, Charlene.
Oh, man, it's not good. He's a blocker. Yes, he is. Oh, look at that. Oh, my goodness. Give me a break. Oh,
good.
14.
You like this game? You like this game?
Yeah.
It's a good
It's
game.
fun.
Yes.
Yeah.
You
Sounds
know,
good.
there's some action.
Action.
Yeah. 18.
Okay.
Oh, 19.
19 to 2.
One more, Mr. Kennedy. Come on now. Slam it in. Almost. All right.
Good job.
Same place,
job.
same time, the next time.
Very good.
You did good.
As you can see from this video, Mr. K was totally engaged in this activity. In fact, this was a very normalized activity. He was interacting with a number of health professionals in a very normal way. And you can see by his facial affective stance how meaningful this activity was. In fact, when the doctor walked in and observed Mr. K, he said to him, "Mr. K, you're ready to go home." Clearly an example of how we can use activity in almost any practice setting. I would now like to share with you some of the promising data from a small pilot study we have conducted, sponsored by the National Institutes of Mental Health in the United States. This involved 60 people living with dementia at home who were demonstrating a wide range of agitated type of behaviors. And through a very purposeful 8-session home-based intervention in which occupational therapists observed the home environment and assessed the person with dementia's abilities and interests, various activities were developed. And look at the outcomes that we show. We show a significant decline in the frequency of a range of behavioral symptoms, and specifically shadowing and repetitive questioning or repetitive vocalizations, which were the two types of agitated behaviors that caregivers complained the most about or were most upset about for this sample. We also show enhanced activity engagement and an enhanced feeling of pleasure and showing pleasure of people with dementia. And these are very large effects of these changes. Also, in this graph, we show that close to 80% of those who were in the activity intervention, referred to as the tailored activity program, improved who received the intervention, compared to 40% in the control group who did not receive any active intervention. So close to 80% of caregivers reported an improvement overall in behavioral symptoms. If you look at the worsening of behaviors, because behaviors do fluctuate over time, by 4 months, we see that those who did not receive the intervention, over 60% of families reported that behavioral symptoms worsened, compared to about 20% of those who were in the intervention group and received the tailored activity program. Look at the effect of this approach on the families reporting patient agitation at 4 months. At baseline, the two groups were basically the same, with about 40-some% of families reporting agitation. By 4 months, this percentage drops to under 15% for those who receive the tailored activity program, but stays the same at 45% for those who did not receive the intervention. This approach also had a very important impact on families. Families themselves reported that they experienced less time having to do things for the person they were caring for with dementia by about 3 hours. They also reported almost a 5-hour reduction in feeling that they were always on duty and having to supervise the person with dementia. And that is because the person with dementia was actively engaged and happily engaged in various activities. So here you see from a pilot study the emergence of solid data that supports the approach. And we are now testing this approach in multiple sites in Europe and throughout the United States. So here are some of the take-home points I would like you to think about. First, there's a growing evidence base for using activities to maintain quality of life and also to prevent and reduce behavioral symptoms, as well as to reduce the burden that families themselves feel when caring for a person with dementia over time. Critical to the use of activity as a therapeutic agent is that activities must be tailored to interests and abilities, as well as the physical and social environment of the person and the time of day. It's important to keep in mind that almost any activity that you can come up with is able to be adjusted to meet the cognitive and physical capacities of people with dementia. You may need to rely on a health professional to help you understand what those capacities are, however. It's also very important to understand that we can use activity in any care setting, and it is a useful therapeutic tool for people with dementia at any stage of the disease, so that a person cannot have too low of cognitive functioning for an activity to be successfully used for that person. Keep in mind as well that we need a lot more research concerning the timing and type of activities that are most successful and the best ways to modify activities and to really understand which activities are best, social, physical, cognitive, or a combination for reducing behavioral symptoms. But this is a very important and promising avenue that I hope you will consider using in your own care and also participate in building the evidence for this non-pharmacologic approach to helping people with dementia maintain quality of life. Thank you.